Hi, this is Dr. Jenny Byrne. I'm the committee chair for the North Carolina Psychiatric Association Technology Committee, and today I want to spend a few minutes on a video to go through some of the different televideo options that you might see. And goes along with a little spreadsheet I created with some different services and kind of a summary. So basically, you've probably heard that there are a lot of televideo services now. There's kind of an explosion within the last year or so, and they might be already marketing to you, so you might have been hearing about them already. There are many, many different kinds, and there are many different options, many different prices. Some of them are completely free. So I just wanted to kind of go through some of the options here, and this is by no means an exhaustive list. This is continually growing. So if you look at the worksheet, you'll see that the two that you've probably heard of the most are Skype and FaceTime. And I list these here. The NCPA does not recommend that you use these for televideo because they're not HIPAA compliant. But I did include them here because you probably have heard of them or you've probably used them just in your own personal life. So I wanted to put them here as a comparison. But again, the official position of the NCPA is not to use any sort of televideo program which is not HIPAA compliant. So moving down to the third one on the list, VC, I've done a little video, a separate video to kind of show you how this particular system works. This is the one that I sometimes use in private practice. I like it because it's HIPAA compliant, it's pretty easy to use, and there is a free version, and actually that's the version that I typically use. So here's the website for VC. And you can kind of, if you go down, you can see that they have a lot of different options. This one-click video calling, that's what I typically use as a solo doc calling a patient. Now you'll see that there are other things in this program you could use. You could integrate it into an app, a website, you could build a web portal. And what you're going to find more and more is that with these televideo services, they have all these different modules which you can access, but you don't have to. So if you're just using televideo sporadically, once in a while, to talk to a patient who can't come to the office, you probably don't need all the bells and whistles that a lot of these things offer. But if you want to really grow a televideo practice, and in the future this may become more common, then you might want to get into some more of the features. Another option is Cloud Visit, and Cloud Visit is similar to VC. It's HIPAA compliant. There's a login page. You can use their scheduler. You don't need any special equipment. The main difference here is there's not really a free version. You can get a free trial period, but there's no free version. So this one's fairly simple, and it's designed for telepsychiatry, but there is a monthly fee. I think currently it's about $100 a month. Then there's another one here. This is called SnapMD. Again, there's no free version of this. It is HIPAA compliant. You have different options if you want to have practice management tools, and you have to go in and actually request a quote to see what the cost would be. This one's kind of interesting. This is called HIPAA Chat. This is something that's not really designed for telepsychiatry per se, but it's a HIPAA compliant chat mechanism that you could talk to other doctors about your patients in a HIPAA compliant way. It could also be used to connect with patients directly. It's designed for mobile use, so it's designed really to be used on your phone. So this is less of something that you would sit at your desk and use and something you'd use on your phone kind of on the fly. So if you had a patient call and you wanted to keep it HIPAA compliant, and you wanted to chat, you could do it this way. Now, this option, I'm going to show you two options where you have these kind of more complicated telehealth systems. You could use this in a small practice, but it's probably more complicated than you need. So this one's CardioCom. There's no free version. Again, you have to kind of request a quote. It's very customized. So I think for the small practice or solo practitioner, these systems are going to be less helpful. You just really want something that's very simple. You don't need all the bells and whistles. But just so that you kind of see, this is one option. We counsel, this is another really interesting one. There's a free trial for this, but there is no free version. However, the monthly cost can be as low as $30, which isn't bad. So they have a little video here, and I'm going to play the video. because I think it's a nice little example of how you might use their system in telepsychiatry. So I'm going to go ahead and play that here.
Take your typical mental health professional. Let's call him John. John's an expert when it comes to counseling his clients, but as a mental health provider, his life is filled with paperwork, filing cabinets, and canceled appointments by clients that struggle to make it to their sessions. One of these clients is Chloe. Chloe suffers from moderate anxiety, and while she has been meeting with John for the past few months, her progress has been slow. Because she's a busy mother of 3 and works during the week, she's had to cancel more than half of her appointments with John, leaving them both frustrated by the loss of their counseling sessions. So how can we keep the two connected? With WeCounsel, John can conduct secure counseling sessions with clients like Chloe through our high-quality, HIPAA-compliant video conferencing system, providing Chloe with the opportunity to receive John's services without ever leaving the house. That way, John can be assured that his professional time is well managed with more consistent counseling for his clients. John will also be able to message his clients, schedule appointments, store session notes, and send or receive worksheets and forms, allowing him to take his practice completely online and work at any hour of the day. But WeCounsel doesn't just make life easier for John. Chloe will have access to her own interactive profile, where she can message John, schedule appointments, maintain monthly goals, and keep a private journal log. But, best of all, she can enjoy treatment and put an end to those unwanted anxiety attacks without ever leaving the house. Therapists and clients in our network can stay connected and stay happy. So if you want to simplify your work life, join WeCounsel.
So again, this is kind of designed for therapists, but certainly psychiatrists could use it. You hear how they have some other options like note keeping, scheduling, etc. Again, it really depends how you want to use this tool, and so I encourage you to think about, if you want to use televideo, what are you using it for? Do you really just want a simple tool that you can use once in a while, in which case a free version is probably fine, or do you want something that's going to do more? That's going to do some practice management for you, that might provide your patients with some more online resources. So there's no right or wrong answer. I'm also just going to really quick show you something here. This is called Touch Care. Now I'm not including this on the current presentation, but this is a local company in North Carolina, and we're going to be speaking with them, and we're going to be providing you with a separate video on this service because we think it's a little bit different. So again, thanks for listening, and this is just a quick overview of some of the different services. As always, I recommend that you think about exactly what you're going to use televideo for, and then that'll kind of guide you in deciding which one to use. And I would definitely try a free one first, or try something with a free trial. You really shouldn't need to invest a lot of money up front to see how this would work for you. So good luck, and we'll have a video on Touch Care sometime in the future.